My name is Natalia Allegretti, and I am a Senior Innovation Project Manager at the ECHAlliance. And very welcome to this session where we will delve into how standardized reimbursement mechanism can foster the adoption of digital health solutions. The reimbursement process plays a crucial role in accelerating the adoption of digital health technologies for several reasons. It not only provides substantial financial support for their adoption and implementation, but also conveys a distinct message to end users and decision makers that these technologies have undergone a very rigorous evaluation. Drawing from the successful examples of France and Germany, this panel brings together representatives of the demand and supply side of the market. They will share with us their experience with national reimbursement models, providing insights into opportunities and potential challenges within this transformative journey toward a more digitally empowered healthcare landscape. The session is hosted by the EU-funded project Digital Health Uptake, whose goal is to streamline policies, strategies, instruments, and activities to promote the adoption of digital health solutions and services in Europe. And worth to mention and powered by the DHU project is the Radar, which is a unique platform that facilitates the sharing and exploration of digital health innovation in Europe, connecting both creators and users. With great pleasure now, I will introduce to you all our speakers, starting with Louisa Stüwe, Project Director, Digital Health Delegation of the French Ministry of Health and Prevention, Kai Schnackenberg, Deputy Head of Division of International Affairs and Innovation at Ministry of Social Affairs of the Free and Hanseatic City of Hamburg, Jens Nörtershäuser, Founder and CEO at Kranus Health, Hendrik Steinert, Head of Strategy and Business Development at mementor by Resmed, and Fabien Watrelot, Chief Executive Officer at Ensweet. Before leaving the floor to Karolina Mackiewicz, ECHAlliance Innovation Director, that will moderate the panel discussion, a kind reminder to all our panelists to really stick to the time. And then please note that at the end of the first round of presentation and discussion, we will open the floor for questions coming from our audience. Karolina, please, the mic is yours. Thank you.
Thank you, Natalia, and welcome everyone to this session. As Natalia already explained, this session is hosted by the Digital Health Uptake project. So we want to frame this discussion about the reimbursement models on how they can support uptake of digital solutions for health and care. And we decided to invite the people representing the most maybe advanced reimbursement models in Europe, so from France and from Germany, and also people representing the two sides, so the authorities and those who implement the develop and want to implement the digital health solutions. So after the first round of introduction, as Natalia said, we will have a discussion because we want to learn what are the different experiences and expectations of those two sides and what are the lessons learned for all of us who want to boost the implementation of and uptake of digital health solutions in Europe. So I think without further ado, we would like to invite Kai to present this model that works in Germany, and after that we will go to Louisa to present the French model, and we will hear from the representatives of the companies what are their experience, what lessons. So Kai, I want to invite you to share the information about the German framework.
Thank you very much. Let me shortly share my screen. One moment. No. So, no. One second. No, it's not working. Sorry, I have a technical issue.
Maybe you can start, Kai, while we are trying to, when we will put your slides. Is that okay?
Yes, please. So I rearranged a little bit the slides, but maybe you can try and yeah, I can start. So the German system is digital health applications. It's the DiGA. DiGAs are reimbursable digital medical devices with a low risk that support the detection, monitoring, and treatment of alleviation of disease. So we have in the social book 5, that's the German legislation about health. The next slide, please. That insured persons are entitled to care with low-risk medical devices whose main function is essentially based on digital technologies and which are intended to support the detection, monitoring, and treatment or evaluation of illness or the detection, treatments, evaluation, or compensation of injuries and disabilities. So one important note is that we will have the Digital Act, which comes to enforce next year, with the scope of applications of DiGAs will be extended to medical devices with a higher risk classes, for example, to cover telemonitoring. Next slide, please. The so-called apps on prescriptions are modern therapy companions and enable greater therapy success. Patients can use a DiGA either alone or together with the doctor. Authorization is generated by the BEFRAM. It's a Federal Institute for Medicines, and where a so-called positive care effect must be proven. That's a very, very important thing, and maybe we can later come in the discussion to it, because it's often difficult for startups to immediately prove a benefit for the new application. And it's often really a discussion, this point, so what is innovative, what is a better app. So it's really one of the main points that are crucial in this context. Next slide, please. Since May 2020, DiGA manufacturers have been able to apply to the BAFRAM for inclusion to the DiGA directory. Inclusion to this directory legitimize the manufacturers of the DiGA to negotiate for reimbursement. There are 48 available DiGAs, of which 22 are provisionally included and 26 permanently. So a small overview about the different categories. So in psychological context, we have 24 DiGAs, absolutely the most. And other diseases are a bit more less inside. So we have muscle, bone, and joints, metabolism with 6 and 5. And then it goes to very, very few DiGAs there now in the list. Next slide, please. So people with statutory health insurance have the option of obtaining a DiGA via prescription following a medical or therapy decision. Also can apply directly to the health insurance provider. In that case, they must provide evidence of a corresponding diagnosis to the health insurance fund. Next slide, please. So there is a report that the health insurance needs to address to the Federal Health Ministry in Germany. It's a very important report, and between 2020 and 2022, around 200,000 DiGAs were prescribed by a doctor or authorized by health insurance. So we have nearly 90% prescribed by a doctor and just 10% directly by the health insurance. And quite important that the 5 most frequently used DiGAs accounted for 66% of all prescriptions. and the majority of DIGAs are located to the indication area of mental illnesses. But if you see how much DIGAs are related to it, it's quite clear that it's so often. And the second most category with the most prescriptions can be found in the indicated area of metabolic disease and musculoskeletal disease. So, and finally, I will come to a short outlook in the next slide. So what is in the pipeline? We will have the digital care applications. They are now liable for reimbursement. It's a very, very new decision of this October. They are intended to support people in need of care and their independence, to promote their abilities and facilities of care and support by relatives. This can include, for example, offers for leisure activities, memory training, or fall prevention, or products that are used for communication with relatives or care services. And I think it's very interesting what will happen to this care applications, and maybe it will help for really a wider use of this digital support tools. So that's from my side. Thank you very much. And
thank you, Kai, for presenting. I think we, even from this short outlook, from the short overview, we learn a lot. And you said that 203,000 DIGAs were prescribed over the course of 2 years. Do you have any view into the feedback of the patients on if they were happy with this framework, with this arrangement?
I think it's 200,000. It's on the one hand a huge number, but I think if you see nearly 90 million Germans, it's really less, and there needs to be much more promotion, and it's yeah. So
okay, much more promotion. Yeah, it would be also great to look into some statistics, if this is raising, if this is like went on plateau or something. But we can come back to this also in the next part, and also hear from those who develop the applications, what's their experience. So thanks for this German perspective, and then we will move to Louisa Stüwe, who has her slides being open now, to tell us about the French, is it Pecan or some other way that you pronounce it, framework. So Louisa, please.
Thank you so much, Karolina, for the invitation. It's a pleasure to be here and to present the new fast track for digital medical devices in France. So actually it's called Pecan, as you correctly said. I'm working in the French Ministry of Health and a digital health delegation, but we have several actors actually coordinating the deployment of this new fast track. So let me say a few words about what this actually means in practice and how can we situate it, because it's important for you to know that this is part of a global national strategy that we have put in place in France to deploy digital health, which is the current roadmap for 2023 to 2027, in the sense of a state as a platform model, meaning that we deploy innovations in a framework that ensures standards of interoperability, ethics, and security. So the state sets clear guidelines for the private sector to work with it and develop solutions, but they need to apply those different standards in their solutions. So that's quite important. And Mon Espace Santé is quite a good example of that. Mon Espace Santé is our national health record, personal health record. And so all the solutions that come on top in the catalog, they need to go mandatorily through this certification process. Now, this roadmap contains 4 elements, and one of them is access to health, and that is also where Pecan is situated, that I'm going to speak about in just a bit. Now, as I said, there are several actors involved, and it's important for you to know them before we go into detail about the fast track. Not just the Ministry of Health, which is mainly setting the guidelines, the policy, and so on, as is also the case in other member states of the EU. We also have a digital health agency, which is our operational arm, which does most of the technical and security and interoperability checks. So it's quite important to know that we have such an agency at the national level. you had just heard the German presentation, I would say maybe Gematik would be the equivalent. In terms of health insurance, as all of this also tackles obviously reimbursement, speaking about fast track reimbursement, we have the CNAM involved. The CNAM is the National Health Insurance Fund. And the Health Data Hub obviously is also an interesting institution because it basically offers access to data of also the usage of such solutions at the end of the day for secondary use, for public interest research. So all of these actors come together, not just at the national level, also at the bottom of the scheme. You can see regional actors and obviously the hospital research actors, innovators, patient associations. Obviously, they're all part of the whole construction. But the main decision makers, I would say, are the four instances up there. Now, also on the timeline, so we have put ourselves now in this 5-year pluriannual strategy, but there will be more obviously after, since we're in the context of France 2030, which is our reinvestment, relaunch plan of the economy. So obviously this is the whole economy concerned, so it's just part of a big puzzle. Now, also interministerial, so there's different actors involved as well, not only Ministry of Health, but also economy, research and education. So you can imagine also in other countries, those strategies obviously need input from different expertise fields and different ministries' heads. Now, the Digital Health Acceleration Strategy is the funding program specifically for digital health innovation that PECON is part of. And you can see the rocket basically composed of 5 components from end to end, basically from the lab to the uptake of innovations in practice, and also the prescription obviously by doctors. This means that they need to be trained in digital health. You can just make available solutions, for example, through PECON in the market. You also need to make sure that there's digital health training for healthcare professionals, and all of this is funded with our Digital Health Acceleration Strategy, which is still ongoing, soon coming to its end. So we're already looking a little bit into the results at this stage. Now, as promised, I'm going to speak about PECON briefly. So PECON is the fast track for digital medical devices of 2 types. So on the one hand, we have innovative digital medical devices for individual use, which is the case for both. On the one hand, for therapeutic purposes, they are referred to as DTX in common language, but we also have remote monitoring, so patient monitoring, which is the 2 components of PECON. Now, what you need to know is when you submit a file, there's a parallelized process. So this is what I'm saying here. It's a facilitated application. You submit, if you're an innovator and you have a solution to propose, you submit at the same time for the interoperability security part, which is ensured by the ANS, the National Digital Health Agency. And on the other hand, the scientific part, scientific evaluation and studies, which are submitted to the ECHALliance, which is our Health Technology Assessment Agency. So both happen at the same time, which enhances and makes this process more rapid and easy onto different platforms, which are then being connected. And all of this will give you reimbursement, conditional reimbursement, obviously, for a year, because then you need to resubmit your file with enhanced evidence to ask for permanent reimbursement. So I'm just going back here. As I said, it's transitional and temporary reimbursement. You don't have permanently access to the French market. You can see it as an experimentation as well to see how it works actually in practice. Now, this has been operational since April. There's already price lists which have been published as well. One of them is still pending because it's a very much intersectoral negotiation, but should not be long to be out as well. And what else can I say about this? Well, it shouldn't take more than 3 to 4 months until when you submit, between the submission date and then the moment when you can actually access to the market. So which is quite faster, much faster than what happened before, because already before there were different ways to access the market, but just the time was the big factor, and also the documentation, which was not available the same way. Now, here facilitated, I mean, you get the slides afterwards if you're interested in PECON. Obviously, we can also help you and respond to your questions. But here you can see that those 2 applications happen in parallel, as I said beforehand. Security and interoperability on the one hand, on the convergence platform of the ANS, the Digital Health Agency, and then at the same time, EVATEC for the scientific part evaluated by the ECHALliance. And then this is both sent, after all, if it's all okay, if you have submitted everything fine, and there's maybe a few communication, a little bit of communication, it goes to the Ministry of Health, which then validates, and then there will be a ministerial order published and making a reality, basically, that the solution is on the market, so it's all very formalized, and then you can actually, get access to the patients can get access to your solutions. Here are the whole components which are part of the interoperability and security file that you need to study. And I advise, we all advise that it's good to have someone French speaking in your team if you submit a solution. Even though we have also, there's now the possibility to have an entretien précoce, which is an early interview with the HAS, with the HTA agency, which can happen in English. But on the other hand, some of the documentation is not yet translated into English. So it's good if you plan to have a subsidiary in France to also have several French speakers in your team as well. Now you can check all of this out. It's all explained on our website for Pécan. There's a section on Genius. Genius is our portal for entrepreneurs. I'm going to show it here to you. It explains how the digital health market in France is regulated, who the actors are, what funding tools are available. There's even a few international country sheets if you want to learn more about other countries as well. But anyways, you can learn everything about Pécan there in very easy language. And yes, we also compared ourselves. Nice to speak after Kai on the German model and comparing it with the French one. I would say the scope is a little bit wider than the German model. There's now also to be, I guess, involved with the new reform in the German reimbursement. We're a bit wider than that, I would say, also including high-risk classes of 3 in the submission possibility. And yes, the prices are also fixed differently. As I said, there's pre-fixed price lists that you need to comply with, whereas in the German model, there's a free price fixing, which will then be adjusted afterwards. So there's slight differences, but we're still moving towards harmonization, obviously, at some point with the European Task Force, which is an initiative coordinated by EIT Health, and that we chair actually for the French Digital Health Delegation, together with the coordination group president of the HTA regulation group. So yes, so there's work to also align evaluation standards at the same time while we do these national fast track processes. So here's documentation for you if you want to learn more. And thank you so much for the invitation.
Yeah, thank you, Louisa, for this quick review of the Pécan and also comparison to the German model. So this is now in place since April 2023, right?
Yes.
So it's pretty fresh and new. So do you have any statistics or anything about the how has it been now?
Yeah, it's still, there's a few files. There's actually, I think, more than 10 applications which have been submitted. I need to check on the statistics. But yes, there have been applicants, but it takes time. So we had expected a bit more, but I do think that the documentation and that the burden is quite heavy. As for anything that needs reimbursement, we also expect that the files are of high quality, that they comply with the different standards. So this explains a little bit that there hasn't been an immediate response with immediate submissions, but we are quite satisfied with the number of applications. And so I think in the next 2 or 3 months, there should be better visibility. So I prefer we give you feedback maybe early 2024 on what has actually accessed the market then.
Okay, brilliant. Thank you so much. And then we are moving then. So we heard from you about the system is built and how it should work. And now we would like to invite the representatives of the companies to tell us about their experience with both with DIGA and Pécan. So I will invite Jens, who is the founder and CEO of Kranus Health. So Jens, you have experience with DIGA, but you also told me that you're as Kranus Health also entering the French market. So maybe you can also, in your short presentation, comment a bit on that. So yeah, floor is yours.
Yeah, happy to. Thank you for the invitation, and thank you, Louisa and Kai, for the setup here. Hope you can see my screen now. And indeed, we're also here to help the statistics of Louisa and the French government. We're just about to submit in France as well. Just some very short information about us. I don't want to make it a Kranus Health session, but so you get the picture. We are one of the leading virtual care providers in the space of urology. We started in Germany, but actually now expanding to France. We have several products in our lineup, really ranging from everything from andrology over uro-oncology to urology. So really the full space of urology. We are, I think, quite unique and caring about urology, which is of course both men as well as women, for example, in the area of incontinence. So we started in Germany with DIGA, but we also were one of the first ones to really set up an office in Paris. We have a quite large team on the ground in France, and we've been working extensively on preparing, of course, the PECAN files and everything that is needed to also be an actor in the French market, which is something that I'm very excited about. I think Louisa mentioned the European task force in general. I am a big believer in this area of health becoming one of the first areas in healthcare in general where we can really move towards a European harmonized system. And I think that's a huge opportunity for patients in Europe. So I'm hoping that we move there soon, but I think right now it's looking good. So I was asked to keep this short. So I'm just going to share a few of my own experience as one of the large manufacturers in this space from a CEO perspective. I think there's lots and lots of good things. So we actually, we treated thousands of patients with really better outcomes. And this is something we see actually every day. We get feedback from patients that these kind of treatments actually really offer a better way to treat the diseases that we tackle. I also sometimes call that medicine 3.0. It's really, I think digital therapeutics are a great way to help address root causes and really facilitate lifestyle changes that in many areas of diseases are really required by the guidelines, by the medical guidelines, but the doctors have simply lacked the time in the past to really put these, lifestyle changes into the hands of patients. And so I think it's first and foremost really a big win for patients in Germany, in France, and the rest of Europe. I think when I speak about the German one, obviously when you introduce something new like this, it's just really groundbreaking. It's new, right? It's new for the patients, it's new for the doctors, it's new for the policymakers and the regulators. And certainly in Germany, we saw in the first year that all of us had to learn. But I would say by now, with the BfArM and all the institutions involved, we have a very predictable and well-functioning market access pathway for these type of drugs or these type of treatments. And I think that's indeed something the markets were lacking in the past. And really that's a big positive change from my perspective. And also from the doctor side, we really get, I would say, a lot of positive feedback. In our case, we of course focus on urologists, where we have literally thousands of urologists that have prescribed the product at least once, or in many cases more often. And I'd say when speaking and engaging with the provider community, there is a very widespread positive feedback. That being said, of course, it takes time, right? You need to educate the markets. It's new for the doctors. They need to learn how to handle this, how to prescribe it. So I think it's also the responsibility of us as manufacturers, as large companies in that space to really facilitate that, right? And I think that's where we as Kranus also heavily invest. On the, I think, challenges that still exist, certainly there are still some. I think one of the things that so far hasn't been solved greatly in Germany, and I'm hoping we find a better solution in France, is that the prescription process is too complicated for patients and doctors. There's so many additional steps that basically patients need to go through compared to when they receive a traditional medication. And I think that is really what we should strive for. From a patient perspective, it should be the same as getting, your pack of antibiotics or whatever other treatment you get from the doctors. We need to aim for a similar, easy to understand process. So I think there's still room for improvement here. And also, of course, health insurances are still learning how to navigate DIGA, how to, deal with these processes, which I don't think is a problem. It's just a part of the still growing and still very new market. I think we should not forget that this is, even in Germany, it's just 2 years old. It's brand new. It's really something new. It has some very great results, but certainly it's still a new technology that everyone needs to learn how to master. And to make it short, some learnings and best practices that I can at least speak from our own experience as Kranus Health of. I think when going to the market, it is super important to be close to the providers. So really, companies need to heavily invest in congresses, presence in the field, sales representatives, talk to doctors on a day-to-day level. I think clinical evidence has been underestimated by some of the new startups in the space. I think nothing less than gold standard is what we need. We need randomized controlled trials. That's what we have. We're one of the few permanently listed DGAs with also some of the highest prices in reimbursement because of the clinical evidence that we have. So you need really, it's fair, right? We want the states to pay for this. So we also, of course, need to show and prove that this is the best in class evidence that we can have for this. Data protection is of course key. We're talking here about medical data. Patients need to feel safe. And I think then my last point, I think what's very important is to work with policymakers early on. So we really spend a lot of time with the BfArM in aligning and understanding their position, aligning our study protocols. And we've also spent a lot of time with the colleagues from the DNS in France, with the persons from the HAS, like all of the relevant stakeholders. I think, we need to collaborate together for innovation in digital health. And I think it's really key to be working very closely there, right? And I think for me, that's also the outlook where this is headed. I think we are really on our way to become, hopefully soon, a European harmonized framework. Now we have Germany and France, but we could also talk about Belgium. We could talk about Denmark or Austria, which also have already good frameworks in place. So I think that's where we are headed. I'm very positive and excited about this market in the future.
Super, Jens. Thank you so much for this overlook and also like the advocating for the European harmonized system. Maybe before we go to Hendrik, I just wanted to ask you for this one thing that also Kai mentioned, this positive care effect, that this is often difficult to provide the documentation or the proof of those positive care effects for DIGA. How was it in your case? Was it difficult? Was it easy? I assume you managed to comply.
Well, we did because we're permanently listed, but I mean, the answer here is simple. You need to conduct randomized controlled trials with independent research institutions. And of course, this costs money and time and effort, but I think the BfArM is right to apply the same standards to digital health as they do to traditional medicine. I mean, anything that we give to patient needs evidence, and the way to do this is to conduct clinical trials.
Right. Thank you so much. Actually, like I wasn't maybe surprised, but still I was shocked when I was learning about the applications for apps for women's health, for managing women's health. And I don't remember exact number, but like globally, like most of those apps are actually developed even not only without the participation of target group of women, but they're also developed often without the participation of any healthcare professional. So I think we agree here that yes, if this should be treated as medicine 3.0, this should be proven. We come back to this, but thank you, Hendrik, for opening your microphone and joining this discussion. So Hendrik also comes from Germany, mementor by Resmed, and we would like to hear his experience with DIGA.
Yes, so thanks. First of all, thank you for having me here. My name is Hendrik Steinert. I'm head of strategy and business development at mementor by Resmed. And I thought it would be good to give maybe some context to the company first. So mementor was actually founded already in 2014, a digital health startup which has been acquired by Resmed in August 2020. So we are actually a startup in a in a larger corporate and acting a bit like an incubator or innovation hub when it comes to DTX. As I said, we focus on digital therapeutics, especially in the area of sleep and comorbid indications. We have been the first permanently reimbursed DIGA for insomnia in the German market. The name is Somnio. We currently have a 4.6 rating in the app stores, where we are really proud of. So very positive feedback actually from the patients. We have been one of the first DIGAs in the market. So we just had our 3 years anniversary. And so far, we already treated over 30,000 patients suffering from insomnia. We are headquartered in Leipzig and have around 70 employees in Germany. So I think what's really important when you look into, let's say, new products or the DTX space is actually to identify an unmet need. And here in this case, we identified an unmet need in the treatment of insomnia. So insomnia is actually a quite common disease. Roughly 35% of the adult population suffer from sleep problems, and every 10th roughly suffer from clinically relevant insomnia. And when you look into the guidelines, the first recommended treatment is actually the cognitive behavioral therapy for insomnia, or in short, CBTI. And the second line treatment or short-term treatment is sleep medication. So when you now look into the treatment reality in Germany, and that's actually across all other countries, we can see that only very little amount of patients receive CBTI via their regular or primary care. And the majority actually is receiving sleep medications. Despite being that CBTI is actually the first line treatment in several guidelines in Germany, in Europe, in the US, in Australia, it is really rarely used because we have a huge bottleneck of experts or healthcare professionals who can actually conduct the CBTI in person. So when we then developed Somnio, it's a digital CBTI, actually conducting the treatment, which is normally done face-to-face or a group therapy, is now done via app. On the left-hand side, you can see a little screenshot of the sleep journal, which is an integral part of our solution. We have shown actually very good results in our RCTs. Also, as Jens said, we believe in science and to convince with robust evidence. So our second trial with roughly 240 patients showed that 64% had clinically significant improvements in their insomnia symptoms, which led to roughly half an hour reduced sleep onset latency, so they actually could fall asleep earlier. Over 1 hour reduced wake up after sleep onset, which means you don't wake up during the night. And the good thing is that we did follow-ups after 6 months and after 12 months, and these effects are actually super stable. So even if you stop using Somnio, these effects stay. And we just published actually a real-world evidence analysis. And from my perspective, that's actually the first German-wide DIGA real-world evidence, where we analyzed 5,000 patients who used Somnio between 2021 and 2022. And we could actually show that the RCT results are also reflected in the daily care setting. So that's actually quite good. So you need an unmet need, you need a scalable solution to address the unmet need. And I think then when it comes a bit to the, let's say, chances or hurdles we are currently seeing in the market, I can just reflect what Jens just said. So the prescription pathway for DIGAs is still quite complex. So the physician or the psychotherapist prescribes Somnio or another DIGA. The patient or gets a paper-based prescription. The patient transmits the prescription to his or her health insurance. After some time, gets back a 16-digit code, everything via paper, and then enters the code into the application. And as from our perspective, we see actually two major hurdles or chances. So I just checked actually before the presentation. In 2022, there was a survey where 34% of physicians stated that they already prescribed a DIGA. which of course still leaves potential for more awareness, for more education, and for more usage. That's a big lever. And one of our initiatives from a mentor side is really to educate healthcare professionals and to tailor CME events, so continuing medical education events. And we do that, for example, for psychotherapists, for pulmonologists working in their sleep labs, for GPs, or also for GINs. And we just had a very big event in Cologne where we had like a sleep day. It was on a Saturday, but still we had over 200 participants face to face. It was a really great success from our team. So big lever. And the second lever, as Jens already said, is of course, if you would compare the prescription pathway of a DiGA with a, let's say, traditional prescription, it takes just much longer. It's unfamiliar, and we have to say that there is a risk that patients drop off. Normally, when you go to your doctor, you get your prescription, you go to the pharmacy next door. It takes roughly 5 minutes. The DiGA takes round about 2 weeks until the code arrives at the patient side. And what we actually did from Mementor is that we provide a prescription support service. So patients, for example, can scan their prescription. We will provide it to their health insurance, automatically create an account for Somnio, and the patients can actually wait in like a virtual waiting room until the code arrives. So my learnings are actually find an unmet need in the market, have a scalable solution and robust evidence, and of course try to tackle the hurdles or the chances to educate healthcare professionals and also patients.
Thank you, Hendrik, to adding also the information to DiGA and the experience, and also sharing this perspective. I'm just wondering, you said like about the numbers and so on. Do you and the 6 minutes versus 13 days? And I wonder what would be your suggested solution for to address this on the systems level?
Yeah, I hope we see that then in the future with the e-prescription, which is on the roadmap from the German legislation, and that should hopefully enable a faster and more convenient process for DiGA prescriptions.
Right, because what you told me, it's like also relates to my recent experience when I wanted to realize e-prescription in one of the EU countries, and I was asked to have it printed. So I was just like in argument with the pharmaceutists that maybe e-prescription is not. The idea of e-prescription is to have it digital. Thank you so much. And last but not least, we are moving to Fabien. Fabien represents the French companies, the Ensweet, and is here to share his experience. So this time with the French system.
Right. Thank you. So just let me share my
yes, please.
My PowerPoint, and we can start.
You should be able to do it, no problem, but let us know if there is an...
Yep.
Yeah.
Yep.
Perfect.
We got it. So thanks again for the invitation. So my name is Fabien Watrelot. I'm the founder and CEO of Ensweet, and our mission is to provide access to rehabilitation care for all. We started with the Ensweet Cardio in cardiology, in fact, in order to make sure the cardiac rehabilitation is accessible to all of the patients in France and everywhere in the world. And to do that, we developed the first software as medical device, I would say pre-reimbursed, even if it's not so correct to say that, with the Article 51, which was one of the way to access the market when we launched the product a few years ago. And basically our product, on one side, we have the caregiver app in order to create the program, the rehabilitation program for the patient. And we have the patient app where the patient can receive the program and do it at home. And of course, this application is connected via Bluetooth through a Earth sensor, and we also have offer to deliver equipment, rehabilitation equipment at home for the patients. And talking about the pathway, so the patient, he starts to use the product, the app into the rehabilitation center during 3 days, just to make sure he's able to do the program at home, to train it on the program, and after that, he goes back to home. He does the software. He does the program, and the caregiver team in the rehabilitation center just check the data and check it. Everything is going well for the patients. Oh, let me check. Okay, yes, I have a message on the chat. And so when we started the program in 2019, all of those. So first, Genius, presented by Louisa, wasn't available at that time, and we had only one option was available for us, which was the Article 51. So all of those way to access the market are available on Genius, the portal presented by Louisa at the beginning. And this Article 51 was very relevant for us because it encouraged the patients, encouraged in fact the different stakeholder to create new pathway, in fact, to organize the care. And this is exactly what we do with our software. We design a new pathway to organize the care and to make sure everything is available at home. So at that time, it was very, very, very convenient for us. When we look back, when we look back at the history and what has been done, we faced, I think, like in the DIGA, in fact, we faced some few, I would say, problem or bottleneck into the process. First, because the French government accepted a lot of projects, more than 35 projects, if I remember well. But then it was difficult, and it's still difficult for the French government to evaluate all of those projects and to make sure one is suitable for the system, the other one is not. But slowly those problems have been resolved, and at the end, it wasn't so clear how we can switch from the experimentation side to the, I would say, the real life. But again, hopefully, right now in 2024, the way will be clear, and we have the light at the end of the funnel. To make sure all of those good Article 51 can be deployed everywhere in France, of course, if the evaluation is positive. So my point of view on here, it's what I would say is I think France today it's quite well equipped if we look at that with all of the different pathway for the digital therapeutics, for the software as medical device, in order to access the market. You can start with the Article 51, and this is our strategy then to continue on PECAN on different access. So this is quite clear for us. But one point is remaining. It's the same, if I understood it well, in Germany. We have to change also the way the doctors and the patients, we have to educate the doctors and the patients to use all of the digital therapeutics. Even if we have good clinical evidence, still it's not a real habit for them to use all of these new app. So I think everywhere in Europe we have to focus on that. Train the doctors, train the patient to use all of the digital therapeutics. Thank you so much.
Thank you so much, Fabien, for this overview. And maybe I will ask you immediately this question. So whose responsibility would be to train those doctors in those new technologies? There are so many new technologies coming in. There were all those applications coming to Pecan and to DIGA. So whose responsibility would that be?
So, I think during the study, in fact, the doctors, they have to learn about that. There are a few webinar organized here and there in France. Is very well done to convince all of the doctors, but not so sure this is the job of the startup. We have so many things to do yet, and maybe we have to join our effort with the different government to train the doctors and the patient and educate them to those new therapeutics.
Mm-hmm. All right, I think that this is also a good question to Kai and Louisa. Like, what are how maybe we can start with this short question, and for the sake of time, we cannot explore the whole the all like all levels of this issue. But how do you think like this should be integrated? So we have the legislation, we have the framework. We have the process, but who takes care for the doctors? So and patients' education. Hi, Louisa, do you want to comment on that?
Yeah, sure. Thanks so much also for the very interesting presentations, and happy to hear that Genius is helpful for you and that you are about to apply for Pecan. Yeah, quick in a nutshell. So as a part of the strategy that I presented, the digital health acceleration strategy, there's a training component. So we're really starting here from scratch, I would say. So it's already a first start to actually include digital health training into healthcare professionals' curricula, but also other professions, because it's all like mixed, like there's different actors interacting with doctors, for example. You can't just train doctors, you also need to train the lawyers, the IT specialists, and so on, because everyone speaks to each other. So it's quite important that these professions by next year, mandatorily, for initial training, first of all, will get digital health components in their curricula, and then also successively there will be also permanent training proposed to those actors. So that's one thing. The other thing is obviously, I mean, for the patients, that's again a totally other perspective. I guess it's again collaborative efforts that need to be implemented so that patients can also use digital tools, and that's what we do with Mon Espace Santé very much. We have deployed a network of digital health ambassadors, which actually go all around France voluntarily or even as part of their missions to explain the benefits of having Mon Espace Santé. And I think this has good side effects, because when a patient knows that all of his documentation is his or her documentation is on one sole application and everything is harmonized to that, it will also facilitate the use of other types of applications that then create data, make data available that can also be used in a secure way. So these Mon Espace Santé tools, for example. So there's just two.
I like. Yeah, thank you. I like the idea of the ambassadors. So to really, and I saw also the guys like shaking heads, like approving. Any comment on that?
If I may, I think in Germany it's very complicated because we have this decentralized system, so not a state health system, and the doctors' organizations are very important. And I spoke with a representative of one of the doctors' organizations, and he said it's one point is that the digital natives are coming more and more in positions, but we have a lot of doctors, especially in the ambulant sector. They are quite before getting retired, and for them it's so much digitalization and so much new things upcoming, so it's a little bit difficult to reach them. But I think if we can show the positive effects of digital solution, it helps as well the doctors to prescribe and to take them into account.
Thank you. And we had one question from the audience, actually, and maybe this is the question for our colleagues from the companies about your experience. So there was, of course, some messages about the European harmonized system, and there was a question with the three pathways. Here was the FDA, so also breakthrough, but thinking about maybe 2 DIGA and Pecan available if you have any recommendation on which to choose over the other, or if we build this European harmonized system, I don't know if we have enough of experience already with DIGA and PECAN to say which one should be the model. Jens, you are thinking, do you want to comment?
I think it's too soon to say that, right? PECAN is just launching. It's anyway going to be a collaborative effort between several countries. As I said in my presentation, Germany was the first one to propose such a framework, and I think that's a great first step. But certainly, it's not the perfect system, right? Like I don't think perfect is hard. It's very hard to achieve because you have different stakeholders with different interests here. But I think I'm hoping again the French government is now building on what has been laid out with DIGA, and I know there's a lot of talks between the different authorities in the different countries. For me, the main thing we need to still get better at it, really to make the processes easier, right? I think it's just too much hassle still for patients and doctors, which hinders the effective uptake and limits the potential.
I would agree. Maybe Germany is slightly ahead because the DIGA concept was introduced in 2020. But I wouldn't rank it. I can just echo what Jens just said. I think from a manufacturer perspective, it would be very beneficial for us if we see European-wide harmonization, actually, from a requirements perspective. And of course, then in the next step, countries have to evaluate how can we actually make it accessible. Actually, the examples I've just shown, right, with the prescription process. So there are a lot of puzzle pieces like e-prescription, electronic health records, which play into that. So it's most often more embedded in the larger digital strategy. And I think it's really a joint effort from policymakers, from manufacturers, but also from healthcare professionals to make it work.
Thank you. And I know that my colleague Natalia has a question for you, so I will pass to her.
Thank you. Now, just very quickly, yes, maybe as it has been just said, it's too early to understand which might be, a sort of pathway to support a standardized or harmonized European reimbursement models, given that both models implemented in Germany and France are still too young to set the scene in this relation. But I think today we have learned that there are some fundamental pillars that need to be taken into account to go away to go further in this pathway. And I mean, one obviously has been the education of the market, which is something that everybody more or less said, and facilitating the process. So debureaucratizing, let's put it this way, overall the process, which is going to be another challenge somehow, I would say. But in particular, the creation of a really health ecosystem where all the primary actors are involved seem to be really essential. In all the presentation that you made, for example, companies said it would be more and more important to collaborate really with the policy level. And on the other side, in the presentation of Louisa and Kai, it was underlined that the more than one actors have to work together for the creation of these models. So how much effort, and also given the fact that some healthcare systems are very fragmented, as also Kai was saying, so they're not centralized, which is really the effort for creating this health ecosystem where all the key actors can be put together and be engaged in the development of this model, let's say. maybe I will start quickly. We got 2 minutes left, so just one word from Kai and Louisa, I would say. Louisa.
Sure. Thanks so much for this very relevant conclusion on the need to work together. I mean, again, as we already said beforehand, and was some of you agreed, I do think the European harmonization work needs to really continue while we implement the HTA regulation. So, you know, this text is already finished, published. It will be implemented actually by 2025. But we need, and that's work we have been done at the national levels now, we need to make sure that the digital medical device category there will be ways to harmonize it and to get to make it possible for entrepreneurs to access the markets in a harmonious way and not in 27 markets very differently. That's our priority.
Thank you. Kai.
Yeah, I think one important point is that we have quite different health systems in Europe. So we need to harmonize, but the systems are so different that it can't be the same in all systems. But anyhow, it must be possible for the European companies to go into this market. It's as well a very important economic aspect that our European companies are successful.
Thank you.
I think, Fabien, you have something to add?
Yes, we didn't mention it, but I think we also have to focus on the business model, in fact, in Europe, what we do in France and what we do in Europe. And we also have to admit and we have to keep in mind that it's still difficult also for the venture capitalists to understand what we do and to support us. Hopefully, few of them are very good and they trust in us. But we say we have to educate the patients, we have to educate the doctor, but we also have to educate the venture capitalist, all of those business angel and all, to create let's say a very, very nice ecosystem along that. And of course, it's difficult to have a normalized pathway, a normalized system in Europe. But if we don't do it, we lost the battle of the data against ChatGPT, against Amazon and all of those major players. And this is, for me, this is the real reason why we have to join our effort to make sure in Europe, France, Germany first, maybe, we have to create something big, something very attractive in order to fight, in fact, against all of those players coming from other countries.
This is very important message. And now, just like for the closure, I just want to give you a chance to say one last word from each of you. One wish, one word, one wish for the development of this reimbursement framework for the next year. Jens?
Oh, you put me on the spot here. I think I said it already. My wish is this continues to be taken up by more European countries. I think it's a great model. We need more of it.
Perfect. Hendrik?
Yeah, harmonization. I already said that. And I think to be open and drive innovation in general.
All right. Kai?
More knowledge and more knowledge in the whole population about digital solutions and chances.
Fabien?
Cooperation. That's it.
Cooperation. And Louisa?
Funding is super important, national funding plans. Plus, I think the benchmarking transparency part is important to know what's going on in each country. We're doing this in the eHealth network. And then, of course, I reiterate the harmonization need.
Perfect. Thank you all for this discussion and all these learnings. They will stay with us. There will be recording available on YouTube. And this was all hosted by the Digital Health Uptake project. We invite everyone to also submit their innovation to the Digital Health Uptake Radar. And thank you to all, Louisa, Kai, Fabien, Jens and Hendrik, and my co-moderator, Natalia, for participating in this I think, enlightening session. I learned a lot, and there is a lot of also calls to action. So let's work together on this to make sure that we really uptake those digital solutions for health and care. Now I invite you all for a short break, and we continue at noon CT for the session on how to make data fair. Thank you all.
Thank you.